Thank you, George. Good morning, everybody. Thank you for the opportunity to be here this morning. I was a little bit worried when I looked through the programme for this morning to find that everything I was going to say looked like other people better qualified than me were going to say in more detail afterwards. So my apologies if I'm going to repeat some of the things ahead of other people. But what I wanted to do was just set the tone for today and throw some challenges into the mix about what we're trying to achieve and how far we've got, building on what Rachel and George have said. As we noted, the Prime Minister's challenge on dementia 2020 is what we're working to at the moment, with an expectation that that will extend beyond 2020. And it was at the Alzheimer Society annual conference in 2012 that the Prime Minister made that commitment to lead a nation in tackling dementia. And the significance of that is incredible. Government is very siloed. Government departments work alone, and they almost automatically reject something invented by another department, almost on principle. The only person who can get unified action is really the Prime Minister. It's only from Downing Street that you get the whole all aspects of government working together to mobilise the whole of society and the whole of public services. And that's what David Cameron put in place, and I'm very pleased to say that Theresa May has renewed that commitment. I met with her in December. Interestingly, the day, you remember when she went to Brussels at 6 o'clock in the morning to sign a document? Well, she was due to meet with us and a group of people with dementia at 11 o'clock that morning. She turned up 15 minutes late and apologised for being late and asked for a strong black coffee, but then engaged wonderfully and showed her commitment to actually continuing the programme that her predecessor developed. And there were three main headings in that programme: improve care and support for people affected by dementia, increase awareness and the prioritisation that dementia is given across all government departments and across society, and increase funding in research. And what I want to do is sort of take stock of how far we've got on each of those. I'm going to use as my sort of theme the Alzheimer Society's own strategy, which is called A New Deal on Dementia. And we'll be talking some more about that at our conference in about a month and a half's time. Most of the data I'll refer to, picking up on George's point about evidence, will be from last year, because we'll be announcing a whole load of new data at that conference on the 22nd and 23rd of May. So I don't want to steal the thunder of what will be announced then. But I want to give a flavour of how far we've come and how far we've got to go against 18 commitments that are in the Prime Minister's challenge. There are 18 key commitments covering support, societal change, and research. And it's just good to see that we've come an enormous way from where we were 5-6 years ago. As Rachel said, a long way from when the original dementia strategy was produced in 2009, but a long way still to go. The biggest change I wanted to highlight to begin with has already been referred to, which is the dementia statements. So when we produced the dementia strategy with the government in 2009, we produced something called the Dementia Declaration, which was a set of statements from people with dementia talking about what they wanted. And it was I want, I need. They were called the I statements. And to be honest, they were produced by a small group of people with dementia in a room on one day when we got them together, and they said, what do you think we want? And it was good. It set a basis for the Dementia Action Alliance and a basis for all the work that then followed. But it wasn't good enough. And so last year, a major piece of work that we helped organise from Alzheimer Society was to produce the dementia statements, and literally hundreds of people were involved, people with dementia and carers, in producing the dementia statements. And I just want to read them out, because these are now 5 statements that are the bedrock of everything that we should be doing over the next few years. And the most important thing is the first 5 words of each statement, which is we have the right to. And that's saying that it's not about a dependency culture. It's not about what people want done to them. It's what they have a right to and what they can expect from a modern society today. And that, I think, is fundamental. Also, the very first word, we, is a significant change. So when the original declaration was produced, it was the I statements. These statements recognise that people and their family carers are equally part of the community that needs to change to support people well. So let me just read out those 5 statements, because they are absolutely fundamental, and there's a lot of meaning caught up in them. So the first one, we have the right to be recognised as who we are, to make choices about our lives, including taking risks, and to contribute to society. Our diagnosis should not define us, nor should we be ashamed of it. And just highlight one bit of that is the right to take risk. And I think what depresses me, and this is part of the journey we're on, is that we are very risk averse. I was just saying outside over coffee that I went and spent a couple of days living in a care home because I wanted to see what it was like. And if you go and visit, they just show you around and you see everything and you say, isn't it wonderful? So I went and lived there, and I think they thought I was a resident after a bit. They told me when I went to bed to prop a chair under the door so that nobody could come in through the night, because one of the other residents would steal my false teeth in the middle of the night. So I thought, okay, there's a lot hidden in there, but I was just sort of blended in. And I remember sitting and chatting to somebody, one of the residents, on one of the days I was there, and I said, oh, why don't we have a cup of tea? And she said, oh, we're not allowed to make cups of tea because it would be dangerous for us to use a kettle. So a very simple example of risk aversion. And I think people with dementia have the right to share the risks that all the rest of us have in everyday life. And so just one example of why the dementia statements are so important. Second one, we have the right to continue with day-to-day and family life without discrimination or unfair cost, to be accepted and included in our communities, and not to live in isolation or loneliness. So again, maybe just I'd highlight one bit of that, and that is the unfair cost. Let me just read you something which I think is quite significant. If you develop dementia and require long-term residential care, you are likely to have to use a significant chunk of your savings and the equity in your house to pay for that care. But if you require long-term treatment for cancer, you won't find anything like the same cost. Now, I've been saying that for a number of years. The significant thing is that was said by the Secretary of State for Health and Social Care, Jeremy Hunt, in a speech he made last month. So again, I think there's real evidence that we're moving in the right direction. But of course, words come cheap. It's very easy for him to come up with the speech he did last week, which was 7 principles for social care. What we now need to see is the evidence that the unfair cost that is falling on people with dementia and their family carers is being tackled. The figures, as I say, will be updated in our conference next month, but last year we found that typically people with dementia are paying £100,000 of their own money for their care, whereas, as Secretary of State Jeremy Hunt recognised, if you have cancer, you get it paid for by the state. Another disease, one is treated by NHS, one treated by social care. Some people are paying up to £500,000 for the care and support they need. So that second statement is incredibly important, the right to participate without discrimination or unfair cost. Third statement, we have the right to an early and accurate diagnosis and to receive evidence-based, appropriate, compassionate and properly funded care and treatment from trained people who understand us and how dementia affects us. This must meet our needs wherever we live. Again, let me just draw out one bit of that, trained people. We did a study last year that found 1 in 3 home care workers supporting people in their own homes who are dealing one-to-one with people with dementia, often living on their own. We know that around about 2/3 of people with dementia in the community live alone and need that support. Those people, those home care workers, 1 in 3 of them not only have inadequate dementia training, they have no dementia training at all. And what's remarkable is what a good job they do, the dedication of those members of staff. And when we surveyed them in a survey we did with Unison, we found that they all wanted to be better trained. They all wanted to get the support, but the providers didn't have the budget to do it. And we worked out that if each local authority set aside £20,000 on average for training, so outside the commissioned income that they pay, the commission fees that they pay to the provider, if they had a £20,000 budget, which is nothing, you could provide base level dementia training to every home care worker. So that right to properly trained staff, properly trained support is absolutely fundamental. The fourth right, we have the right to be respected and recognised as partners in care, provided with education, support, services and training, which enables us to plan and make decisions about our future. That is probably one of the biggest changes we now need to see happening, is that right to see people as partners, both people with dementia and carers. So I'm proud to say that last year in Alzheimer's Society, we consulted over 1,000 people in the biggest survey ever of the interests and concerns of people with dementia. Previous surveys have been a bit inadequate. I went to one survey that was done by a group of care homes, and they commissioned Ipsos Mori. And I said, how did you do your survey? And they said, oh, we left the questionnaire in the lounge in the care home and people filled it in. And I said, how many people in the care homes have dementia? And they said, oh, around about 80%. And I said, how many people filled in the questionnaire? And they said, good point. And so we did a survey. We actually got Mori, and this was quite groundbreaking. We got Mori to train our volunteers, excuse me, Mori to train our volunteers to be qualified researchers. So we learnt research methodology from Mori, but we know through our volunteers and staff how to communicate with people with dementia. And we did the biggest ever study and to find out what people want. And we're going to be renewing that and keeping that going. We now have a virtual panel, a virtual advisory board for all our board meetings at Alzheimer's Society, so that we consult with a panel of people on key agenda items to get their input. Not one token person with dementia who sits on the board who's expected to represent everybody, which I think is totally unfair and unrealistic. It enables you to tick a box, but actually a panel of people. How many organisations are doing that? How many local authorities are doing that? How many parts of the NHS are doing that? How many care homes are doing that? Probably not very many. And the final right, the final dementia statement is we have the right to know about and decide if we want to be involved in research that looks at cause, cure and care for dementia and be supported to take part. And a key part of that in the dementia commitment, in the challenge, is the joint dementia research, the opportunity for everybody to contribute. And there's a target in there of 25% of people with dementia being enrolled in joint dementia research and 10% participating in research. Now, we may not get there, but I don't believe you should change the target. Targets are something to aim at, and we should keep pushing as hard as possible. The latest figure I have is that just under 35,000 people have enrolled in joint dementia research, and just under 10,000 are participating in studies as a result of being part of that. That's a sea change from where we were. Almost 1,000 researchers are now using that mechanism. And it's incredibly important, because if you want people to develop a career in dementia research, and we know far too little about dementia, that ability to link into a community of people who want to be in research cuts out a lot of the time it takes to get your research going. So it is a real significant step change, but a long way to go. So those are the 5 statements, and I just wanted to spell those out and just illustrate how they show what needs to happen and how far we have to go. Let me just quickly go through those 3 areas that I talked about that are the areas of key concern, and just flag some of the distance we still have to go, and I'm sure others will catch up and follow up on that. So a new deal on support. So diagnosis rates have got better. We now have 67% of people across England getting a diagnosis of dementia. And the government pats itself on the back and says, isn't that good? Well, actually it is good, but that means 1/3 of people with dementia don't get a diagnosis. 1/3 of people go through life not knowing that they've got a disease, their family carers being confused, the doctor not knowing how to support them. So it's a lot better, but we're not there yet. Also important, and this is a constant theme when you look at how far we've come, is the postcode lottery. So in southwest Lincolnshire, the diagnosis rate is only just over 50%. In Islington, it's over 90%, and there's all gradations in between. So yes, we've come a long way, but a lot more to do. If you look at post-diagnostic support and the ability to support people in the way they want, there's a thing called the CCG, the Clinical Commissioning Group's Impact and Assessment Framework, which is a bit of a mouthful, but it's a way of rating whether clinical commissioning groups are doing what they should be doing on dementia. And last year's study found, and it's a classic rating system that goes from outstanding, good, requires improvement, to inadequate. Only 21, this is over 200 CCGs, 21 were outstanding, 99 were good, 66 required improvement, and 23 were inadequate. That's not great. That's sort of 4 years into the programme that was developed from the Prime Minister's challenge. That's what, 7 years on, 8 years on from the dementia strategy, and we still have 23 to over 10% of CCGs inadequate in the support they provide. So there's a lot more to be done. We have changed the conversation a lot. Last year we gave out 130,000 copies of the Dementia Guide, which is a book we published with NHS England, ADAS and the Royal College of GPs. So it is getting out to people, and there are copies outside on the stand if you want to pick one up. But we still get over 40,000 people contacting our helpline every year who otherwise wouldn't get support and are struggling day to day. The New Deal on Society is about changing the whole conversation on the way in which people talk about dementia. You won't be able to read what it says, but I love that infographic up at the top and the little speech bubbles around it are showing different aspects of being a dementia-friendly community. I think the point is it's a positive, happy image. It's saying you can live well with dementia. We had a target in the Prime Minister's Challenge of 75 communities enrolling in being dementia-friendly. We've now got over 300. And we have an evaluation process to actually assess whether they're getting there. So there's an annual registration, and it's all about becoming dementia-friendly. I get very annoyed when people say they've got there, because they're on a journey. They haven't got there. There's a long way to go. And they have to prove that they're engaging with people with dementia and that they're measuring the impact. Absolutely, as George says, we need to see that it is making a difference. So that's absolutely key. But of course, as well as the dementia-friendly communities, there's the Dementia Friends programme. I'm proud to say, and I checked the figures yesterday, that we now have 2,454,526 dementia friends. And it's increasing by about 1,000 a day on average. That is phenomenal. When we started the Dementia Friends programme, I said we'd like to get 1 million dementia friends, and people said, you'll be lucky. It will never happen. Well, we've now got over 2 million. We're heading on to 3 million. That's changing the whole nature of the conversation on dementia. I was sitting on a bus the other day, and there were 2 women behind me talking about their friend who had been diagnosed with dementia. And actually, they were getting it all wrong. And I almost turned around and said, excuse me, but you're getting your facts a bit mixed up. And I thought that was a bit intrusive on a bus. So I just sat and listened. And for about 10 minutes, because the bus was stuck in a traffic jam, for about 10 minutes, I thought the interesting thing is they were having the conversation. I think a few years ago, they simply wouldn't have had the conversation. And Dementia Friends is about making it possible to talk about dementia. It's not rocket science. It's not incredibly difficult. It's run by wonderful volunteer champions. Some of you may be champions in this room. Over 10,000 champions. It's fueled, if you like, by Alzheimer's Society, but many other organisations take a lead. And I think that leadership, that change in the conversation, makes all the difference, because it gives permission for people to come out of their front door to say, I have dementia, I need support, and to know that people will be supportive. We now have Dementia Friends programmes in 35 other countries around the world, which is a real tribute. Over 14 million people globally have now become dementia friends, and every day more people are getting involved. And finally, the New Deal on research. Well, as I say, we got people enrolled in research, but we're actually putting more money into research than ever before. So one of the great achievements that the government should be enormously proud of is the setting up of the Dementia Research Institute. And we got an initial £150 million for that, which is a lot of money. In the grand challenge on ageing, as part of the industrial strategy announced 2 months ago, there's another 40 million that's gone in to build the central building at University College London. And we're putting in 50 million from Alzheimer's Society. We now have 6 centres, so in London, University College London, Imperial College, King's College London, but also Cardiff and Cambridge and Edinburgh all have centres within this virtual network, which is the Dementia Research Institute. And today, so you better get your pens out quickly and send it in, today is the closing date for applying to become the Associate Director of the Institute for Care and Technology Research. And we've said that we're putting at least £20 million of our money from Alzheimer's Society into care and technology, because it is the Cinderella. Dementia research hasn't had the support it needs. We don't know enough, but care and technology is even less understood. And the other thing on research I'd mention is prevention. This is probably the biggest change in research since we started the Prime Minister's Challenge. Last year, there was a Lancet Commission report that showed that 34% of dementia is preventable. And we can now engage in talking about how people can manage their risk so that their dementia increases more slowly. They may even, ultimately, we may be able to prevent some forms of dementia, not all forms of dementia, by modifying people's lifestyles. So a big change. I just wanted to end by recognising the global leadership, and I think this is again paying credit to the government. So not only did David Cameron come and make his commitment in 2012, but in 2013 he held the G8 summit on dementia. And since that time, we've started a global programme of action on dementia around the world that wouldn't have started without the UK's leadership. Wonderful to see. Last year, the World Health Organization adopted a global action plan on dementia. And it has 7 areas: awareness, risk reduction, diagnosis, care, treatment, support for carers, and research. And it's not an easy plan. It's got a 2025 deadline, as was referred to by George and Rachel. We're looking at extending our own programme so it ties in with the global programme. And it's saying that by 2025, 100%, every country in the world should have a dementia awareness programme. And at least half the countries in the world, about 190 countries in the world, so at least half of them should have a dementia-friendly program of some sort to engage people to change the way in which people are supported. So I think you can see in that global action, we're leading the world. We're making the biggest difference ever on dementia. I hope I've illustrated the fact that we've come a long way, but we still have a long way to go. And all of you here, I see, are the sort of vanguard, if you like. You're the people who can make sure that you hold Alzheimer's Society, the government, NHS, everyone needs to be held to task to make sure that we follow through on this programme and make a real lasting difference for everybody affected by dementia. Thank you.